Hey, how you doing? My name is Amiri Gillis,
And I'm Savion Littlejohn.
and today I will be showing you waist and hip circumference, and he will be showing
I
you
will be
two of
the skin folds, which are the abdominal and the tricep. 2 centimeters. Make sure it's 2 centimeters. Mark him up about right here. Mark him up good so you know where your place is. That's when the skin folds come in hand. So you want to pinch right there in between. And hold on, let me switch hands. Pinch. And then put the skin fold over your pinch. Also keep your pinch while the skin fold is on. And his abdominal skin fold is at 20. Then you want to measure it a second time. Same technique. It dropped down to 15.5. So now you want to do it a third time because it's over 1 meter. So let's see what the third one is. The third one is 11.
Hey, how you doing? My name is Amiri Gillis, and today I will be showing you how to properly measure the skin fold for triceps. So it's a vertical fold on the posterior midline of the upper arm, halfway between the acrum and the occrum. So you go down halfway and mark it. And make sure it's in the middle. And while you're doing this, make sure the patient arm is freely to the side of their body. You'll pinch the skin where you marked it. And then a pinch, give it a second, and it's at 35. You can do it another time. It went up to 36, which means you don't have to do it a third time. And that's how you measure tricep skin fold.
Hey, my name is Nakarta Bullock. Today I will be showing you how to do the skin fold measurement. And right now we're doing the suprailiac measurement. So right now, as you can see, the way we measure this is we go right above the hip bone. So we don't really have to mark it for this one. It's right above his hip bone. So then you would pinch this part of it. It would be a diagonal fold. You wouldn't do any other kind of fold. It would just be a diagonal. You would grab the measure. You would pinch not too deep, because then you would just grab muscle. You just want to grab the skin. You don't want to grab the muscle. So just pinch it and measure. Hold it there for like a few seconds. And after that, you have your measurement. And that's the suprailiac. Alright. And then for the thigh is next. So you will pull that up. The way you would measure your thigh. So you will go into the crease of the thigh right here in the top of the patella. So you would do the halfway mark between those on the interior side of the thigh, not the interior. And with that, it's going to measure, hold it right there, babe. So go down to the top of the patella. Which is about 30 centimeters. So then you go to 15. And you would mark that, because that will show you exactly where you're going to be. So then when you get that, you're just gonna pinch it. You have to be careful because most of the time this is the hardest part because most of the muscle is in the thigh. And again, you're not trying to measure the muscle, you're trying to measure the skin fold. So you're gonna tell your patient to put most of their weight on the other leg so that this leg can be relaxed and you can be able to grab the skin more easier. So we just pinch that real nicely right above the mark. Don't pinch on the mark because you're going to use that mark to actually measure. Then you're going to put that on there. Hold it for a few seconds. And that's how you get your measurement for the thigh. And that's all.
Hello, my name is Jamila Dono, and today I will be demonstrating how to measure the chest and the subscapular for a skin fold test. So, this is my participant. So, when you measure the chest, you always do it halfway between the nipple and the armpit. And then once you find that spot on your participant, you will mark it. And then after that, you will make a diagonal pinch with your participant's skin, and then you will take the measurement. Okay, and his measurement came to 10, and that is how you would do a chest measurement. So if you're doing a subscapular measurement, may you turn around, sir? To try to find your participants subscapular, you ask them, can I see your arm, to do their arm like this. And usually when they do like this, you'll be able to see their bone pop out a little, and this is how you will find the subscapular muscle to measure. So you'll just mark it with your pen again in a good spot. You will squeeze horizontally because there's no way you will be able to squeeze like this. So you'll squeeze horizontally. Take your pincher, and then you will get your test numbers. And then you'll do it like that. And that is how you would measure the chest and the subscapular. Thank you.
Hey, how y'all doing? My name is Amiri Gillis. Today I'll be showing you how to properly measure the hips and waist circumference. So, make sure you have a tape measure and a pen to mark where you're measuring from. And when you use the tape measure, make sure you only use the centimeter side. So for the waist, which is here, this area, before you measure the circumference, make sure you measure from the belly button up to 4 centimeters, which is right here. And you don't go no lower or no higher, always below the rib cage. You wrap the tape measure around. Once you get around, her waist circumference is 78. And if you do it a second time, which I'll show you. It's 77 that time. If it's only 1 or 0.5 off, you don't have to do it a third time. But to get the average, you add both of those up and divide it by 2 or how many times you did it. Next, I would do the waist, which is the larger part of the buttocks. You would ask your patient or your teammate to stand with their feet together, which you already have everything. Same as always, use a tape measure on the centimeter side, and you wrap it around. waist circumference. The first time is 100. Second time is 101. It's only one off, so you don't have to do the third time. And that's how you properly measure hips and waist circumference.